1. What is the priority nursing action for a patient with a sudden change in mental status and a history of recent surgery? Answer. Assess the patient's airway, breathing, and circulation immediately. Rationale. A sudden change in mental status post-surgery may indicate hypoxia, hypovolemia, or neurological complications. Assessing airway, breathing, and circulation, ABCs, is the priority to ensure patient stability, as these are critical for life-sustaining functions. This aligns with the ABC prioritization framework used in emergency nursing. 2. Which task can a nurse safely delegate to an unlicensed assistive personnel, UAP, for a patient with stable vital signs? Answer. Assist the patient with ambulation to the bathroom. Rationale. Delegation to UAPs should involve tasks within their scope, such as assisting with activities of daily living, ADLs, like ambulation for stable patients. Tasks requiring assessment, teaching, or medication administration are reserved for licensed nurses. This ensures patient safety and adheres to delegation guidelines. 3. What is the first action a nurse should take when a patient reports chest pain during a routine assessment? Answer. Perform a focused cardiac assessment. Rationale. Chest pain may indicate a life-threatening condition such as myocardial infarction. A focused cardiac assessment, including vital signs and symptom characteristics, allows the nurse to gather critical data for prioritization and timely intervention, ensuring patient safety. 4. How should a nurse prioritize care for 4 patients? 1 with a fever of 101 degrees Fahrenheit, 1 with a blood pressure of 90/60th millimeter of mercury, 1 requesting pain medication, and 1 with a scheduled dressing change? Answer. Assess the patient with a blood pressure of 90/60th millimeter of mercury first. Rationale. Hypotension, 90/60th mmHg, is a potentially life-threatening condition that may indicate shock or cardiovascular instability, requiring immediate assessment. Using the ABC and Maslow's hierarchy, this patient's need takes precedence over fever, pain, or routine procedures. 5. What is the nurse's best response when a patient refuses a prescribed medication due to concerns about side effects? Answer. Explore the patient's concerns and provide education about the medication. Rationale. Therapeutic communication and patient advocacy are critical for informed consent. Exploring concerns respects patient autonomy, while education addresses misconceptions, promoting safe medication administration and adherence. 6. What is the priority action when a nurse observes a UAP using improper technique while transferring a patient with a recent hip replacement? Answer. Intervene immediately and provide guidance on proper transfer technique. Rationale. Improper transfer technique poses a risk of injury or dislocation for a patient with a hip replacement. Immediate intervention ensures patient safety, and providing guidance reinforces proper delegation and supervision responsibilities. 7. Which patient should the nurse assess first after receiving a shift report? A patient with a history of asthma reporting shortness of breath, or a patient scheduled for discharge in an hour? Answer. Assess the patient with shortness of breath first. Rationale. Shortness of breath in a patient with asthma may indicate an acute exacerbation, a potentially life-threatening condition requiring immediate assessment. Discharge preparation, while important, is a lower priority per the ABC framework. 8. What is the nurse's priority action when a patient with a central line develops sudden fever and chills? Answer. Suspect a central line-associated bloodstream infection, CLABSI, and notify the healthcare provider. Rationale. Fever and chills in a patient with a central line suggest a possible CLABSI, a serious complication. Prompt notification allows for rapid diagnostic and therapeutic interventions, prioritizing patient safety and infection control. 9. Which task should the nurse delegate to a licensed practical nurse, LPN, for a patient with diabetes? Answer: administer subcutaneous insulin as prescribed. Rationale: LPNs are trained to administer medications, including subcutaneous insulin, under the supervision of an RN. This task is within their scope, allowing the RN to focus on higher-level assessments and decision-making. 10. What is the nurse's first action when a patient falls in the hospital room? Answer: assess the patient for injuries. Rationale: post-fall assessment is critical to identify injuries, such as fractures or head trauma, and determine the need for immediate intervention. This action prioritizes patient safety and guides subsequent care decisions. 11. How should a nurse respond when a patient with a history of seizures reports feeling off and anxious? Answer: ensure a safe environment and prepare seizure precautions. Rationale: feeling off or anxious may indicate an aura, a warning sign of an impending seizure. Ensuring a safe environment, e.g., padding bed rails, lowering the bed, prevents injury, prioritizing patient safety. 12. What is the priority nursing action for a patient with a new onset of confusion and a blood glucose level of 45 milligrams per deciliter? Answer: administer oral glucose immediately. Rationale: a blood glucose level of 45 milligrams per deciliter indicates hypoglycemia, which can cause confusion and progress to seizures or coma. Administering oral glucose is the fastest way to correct hypoglycemia in a conscious patient, prioritizing neurological stability. 13. Which task can the nurse delegate to a UAP for a patient on contact precautions? Answer: restock personal protective equipment, PPE, supplies in the patient's room. Rationale: restocking PPE is a non-direct care task within the UAP's scope, supporting infection control without requiring patient assessment or intervention. This ensures efficient use of resources while maintaining safety. 14. What is the nurse's priority when managing a patient with a suspected anaphylactic reaction? Answer: administer epinephrine immediately. Rationale: anaphylaxis is a life-threatening emergency requiring immediate administration of epinephrine to reverse airway constriction and hypotension. This action aligns with the ABC Prioritization framework and emergency response protocols. 15. How should a nurse prioritize care for a patient with a new tracheostomy who is coughing excessively? Answer: assess the tracheostomy site and airway patency. Rationale: excessive coughing in a patient with a new tracheostomy may indicate airway obstruction or dislodgement, a life-threatening situation. Assessing airway patency ensures patient safety and guides further interventions. 16. What is the nurse's best action when a patient with a history of heart failure reports weight gain and swelling in the legs? Answer: assess for signs of fluid overload and notify the healthcare provider. Rationale: weight gain and leg swelling in heart failure suggest fluid overload, which can lead to pulmonary edema. Assessment and prompt reporting prioritize patient safety and facilitate timely treatment. 17. Which patient should the nurse see first? One with a pain level of 0.8 or one with a pulse oximetry reading of 88%? Answer: assess the patient with a pulse oximetry reading of 88% first. Rationale: a pulse oximetry reading of 88% indicates hypoxemia, a life-threatening condition requiring immediate intervention. Pain, while significant, is a lower priority per the ABC framework. 18. What is the nurse's priority action when a UAP reports a patient's foresight is red and swollen? Answer: assess the foresight for signs of infiltration or phlebitis. Rationale: redness and swelling in foresight may indicate infiltration or phlebitis, which can lead to tissue damage or infection. Immediate assessment ensures patient safety and determines if the FOR needs to be discontinued. 19. What is the nurse's best response when a patient asks about the risks of a surgical procedure? Answer: provide factual information and encourage discussion with the surgeon. Rationale: nurses must provide accurate information within their scope and facilitate informed consent by encouraging patients to discuss concerns with the surgeon, ensuring ethical practice and patient safety. 20. How should a nurse delegate care for a patient requiring hourly vital signs monitoring? Answer: assign the UAP to take vital signs and report abnormalities immediately. Rationale: UAPs can measure vital signs under RN supervision. Instructing them to report abnormalities ensures timely RN assessment and intervention, maintaining patient safety and effective delegation. 21. What is the priority action for a nurse when a patient with a chest tube reports sudden shortness of breath? Answer: check the chest tube system for patency and connections. Rationale: sudden shortness of breath in a patient with a chest tube may indicate a blockage or disconnection, compromising lung re-expansion. Checking the system ensures airway and breathing stability per the ABC framework. 22. Which task should the nurse avoid delegating to a UAP for a patient with a new colostomy? Answer: teaching the patient about colostomy care. Rationale: teaching is a professional nursing responsibility requiring assessment and patient education skills, which are outside the UAP's scope. This ensures safe and effective patient education. 23. What is the nurse's first action when a patient with a history of atrial fibrillation reports palpitations? Answer: obtain an electrocardiogram, ECG, and assess vital signs. Rationale: palpitations in atrial fibrillation may indicate arrhythmia recurrence, which can lead to hemodynamic instability. An ECG and vital signs provide critical data for decision-making and timely intervention. 24. How should a nurse prioritize care for a patient with a suspected head injury versus a patient with a scheduled medication administration? Answer: assess the patient with a suspected head injury first. Rationale: a head injury can lead to neurological deterioration, a life-threatening condition requiring immediate assessment. Scheduled medications, unless critical, are a lower priority per the ABC framework. 25. What is the nurse's best action when a patient with dementia wanders into another patient's room? Answer: gently redirect the patient to a safe area and assess for safety risks. Rationale: wandering in dementia poses a fall risk and potential for harm. Gentle redirection and risk assessment prioritize patient safety while respecting the patient's dignity. 26. What is the priority nursing action for a patient with a sudden drop in blood pressure after receiving an antihypertensive medication? Answer: place the patient in a supine position with legs elevated. Rationale: a sudden drop in blood pressure may indicate orthostatic hypotension or overdose, risking hypoperfusion. The supine position with legs elevated promotes venous return, stabilizing circulation per the ABC framework. 27. What is the priority nursing action when delegating care for a patient with a high fall risk? Answer: ensure the patient's bed is in the lowest position and side rails are up. Rationale: patient safety is the priority, and fall prevention is critical for high-risk patients. Lowering the bed and raising side rails reduce the risk of injury from falls. The nurse must delegate tasks like checking bed position to unlicensed assistive personnel, UAP, while ensuring proper supervision, as this aligns with safe delegation principles and scope of practice. 28. Which patient should the nurse assess first after receiving a shift report on a medical surgical unit? Answer: The patient with a respiratory rate of 32 breaths per minute and oxygen saturation of 88%. Rationale: prioritization follows the ABCs, airway, breathing, circulation. A respiratory rate of 32 and oxygen saturation of 88% indicate potential respiratory distress, requiring immediate assessment to prevent hypoxia. This takes precedence over stable patients or those with less urgent needs. 29. What is the most appropriate task to delegate to an unlicensed assistive personnel, UAP, for a patient with diabetes? Answer: measure and record the patient's blood glucose level using a glucometer. Rationale: UAPs can perform routine, non-invasive tasks like blood glucose monitoring if trained and within their scope of practice. The nurse retains responsibility for interpreting results and making clinical decisions, ensuring safe delegation while maintaining patient safety. 30. What is the nurse's priority action when a patient reports chest pain during ambulation? Answer: stop ambulation and have the patient sit down immediately. Rationale: chest pain may indicate a cardiac event, requiring immediate action to reduce oxygen demand. Stopping activity and positioning the patient comfortably prioritizes circulation and safety following the ABCs. Further assessment and intervention can follow. 31. How should the nurse respond when a patient refuses a prescribed medication due to concerns about side effects? Answer: explore the patient's concerns and provide education about the medication. Rationale: respecting patient autonomy and ensuring informed consent are key ethical principles. Exploring concerns promotes therapeutic communication, addresses fears, and supports decision-making, potentially improving adherence while maintaining safety. 32. Which action should the nurse take first when a patient's foresight shows signs of infiltration? Answer: stop the infusion immediately. Rationale: infiltration can cause tissue damage and medication errors. Stopping the infusion prevents further harm, prioritizing patient safety. The nurse should then assess the site, remove the and notify the provider as needed. 33. What is the most appropriate delegation for a UAP assisting with a patient in contact precautions? Answer: stock the patient's room with personal protective equipment, PPE. Rationale: UAPs can perform tasks like restocking supplies, which supports infection control without requiring clinical judgment. The nurse ensures PPE is used correctly, maintaining safety and adherence to delegation guidelines. 34. Which patient should the nurse prioritize during a fire alarm on the unit? Answer: the patient on a ventilator in a private room. Rationale: patients dependent on life-sustaining equipment, like ventilators, are at highest risk during emergencies. Prioritizing their evacuation or safety ensures airway and breathing stability, aligning with the ABCs and disaster triage principles. 35. What is the nurse's best action when a patient's family member demands immediate attention during a code situation? Answer: politely ask the family member to wait in the designated area and provide a brief explanation. Rationale: during a code, the nurse's priority is the patient's resuscitation, guided by the ABCs. Clear communication with the family maintains safety and manages expectations without diverting focus from the emergency. 36. What should the nurse do first when discovering a medication error? Answer: assess the patient for adverse effects. Rationale: patient safety is the priority. Assessing for adverse effects allows the nurse to identify and mitigate harm immediately. Reporting the error and documenting follow, but assessment is the first step in decision-making. 37. Which task is inappropriate to delegate to a UAP for a patient with a new colostomy? Answer: teaching the patient how to care for the colostomy. Rationale: Teaching requires clinical judgment and is outside the UAP's scope of practice. The nurse must provide patient education to ensure safety and proper self-care, while UAPs can assist with routine tasks like emptying the colostomy bag. 38. What is the nurse's priority when a patient with a history of seizures begins to seize? Answer: ensure the patient's airway is protected and place them in a safe position. Rationale: seizure management prioritizes airway protection and safety to prevent injury. Positioning the patient on their side and clearing the area of hazards align with emergency response principles and the ABCs. 39. How should the nurse prioritize care for a patient with a blood pressure of 200/110 mmHg? Answer: administer the prescribed antihypertensive medication immediately. Rationale: severe hypertension poses a risk of stroke or organ damage, requiring urgent intervention. Administering medication addresses circulation, a priority in the ABCs, and prevents complications. 40. What is the most appropriate action when delegating hygiene care for a patient with MRSA? Answer: instruct the UAP to use standard and contact precautions during care. Rationale: infection control is critical for MRSA patients. The nurse ensures the UAP follows proper PPE protocols, maintaining safety while delegating non-clinical tasks like hygiene care.